This is National Dyslexia Awareness Month. So what is most important for people who don't know what dyslexia is?
Dyslexia is a specific learning disorder, and it primarily affects the way that people read and the way that people process language. It's a condition that impacts someone's ability to read fluently, accurately, to be able to understand what they've read. And so people with dyslexia can have a hard time recognizing words and spelling words and understanding, decoding words.
How do you determine whether someone has dyslexia?
So as a psychologist, what I do is that I diagnose through doing testing, psychoeducational testing. And we think that testing is important because it really allows you to get the proper diagnosis. Through testing, it helps us identify the student and the individual strengths and weaknesses. And in this way, you can really take that information through testing and then help the child and the family decide on the next steps. For instance, when a child struggles with reading during school years, the information that we get from the assessment and testing can help the parents and the teachers to take action to think about what interventions that they can use to help the child, narrow that gap. Other professionals, healthcare professionals can also diagnose, psychiatrists, neurologists, pediatricians, and those who have specialized training in psychoeducational assessments can also partake in this process. Let's say if their child has trouble reading fluently, if they have trouble kind of recognizing words that they should be able to at a certain age, and some classic signs we call it would be writing letters in reverse. And if this presentation kind of persist over time, by second or third grade even, and if there's really no sign of improvement or making progress despite having adequate instruction, then we would suggest to the parents that, hey, maybe it is time to take a closer look and perhaps go through an assessment to see if there's an actual diagnosis going on that can explain why the child is not able to read or write in the way that would be appropriate and expected for their age.
So what is the testing required? Like what would that like for you, for a child who you suspect may have dyslexia? What would that require?
For a comprehensive testing process, we always start with an intake meeting with the parents. So the purpose of that is really for us to understand what the parents' concerns might be, how long the child has been struggling with these problems, what the symptoms are, because the parent input is actually quite crucial in helping us decide on what test to give. And then with that information, we would come up with a test battery that would be most appropriate for the child's needs. Testing typically would include looking at their cognitive functioning or intellectual functioning, if you will. We look at academic areas of function, reading, writing, spelling, math, and even within reading, we look at the way that the child processes language, understands speech, and listen. Are they able to listen to instructions and comprehend things that they hear? And then we also look at their social emotional functioning, because things like anxiety, depression, behavioral difficulties can also impact or interfere with the way that a child is able to learn in school. So now that you diagnose my child, what's next? So let me also just to clarify that because dyslexia is neurobiological in origin, it means that it's linked to the differences in how the brain processes language and specifically, reading and sound related tasks. So it is not a condition that would just go away. But what we want to do, what we want to help the child with is by having a proper diagnosis, we would be able to inform the parents and the teachers or any adults involved to use specific instruction methods. A very common, or I should say widely researched and empirically supported reading instruction method is called Orton-Gillingham. That's one example of an approach that is multi-sensory based. It's a structured literacy approach that can help children learn in specific ways to narrow the gap in their reading difficulties.
How difficult is it to like work through all of this so that someone who does have dyslexia can then function and to read? I mean, what like how long is this process? Is it complicated?
The interventions, of course, it depends on how severe the case might be, what the reading level of the child is, and what kind of impairments that we're looking at. Is it just dyslexia? Are there any other learning differences? Would there be any other social emotional difficulties involved? And so it really varies on a case by case basis. But our hope is that once the process is started, we're going to be able to help the school better understand, or the teachers understand, how to help the child, and pulling in resources from the school, having academic accommodations to help the child, again, to narrow that learning gap. The testing process itself is it's about a couple of hours, I would say. And but of course, as a psychologist, I would say it's time that is very, very worthy, and it should be well spent on, getting the information that can help the child directly. We're the only school in the entire state of Hawaii that serves gifted and capable students. And so, because we specialize in, helping those with dyslexia and other language-based learning differences, we serve students from K through 12. And so while we, celebrate what the students are strong at, we also highlight and focus on what areas that they need help with. And we try to find a way to teach them what works best for them. And it's a very much an individualized, customized approach in teaching. Our school student to teacher ratio is about 8-1, and we do have 2 campuses that serve students from K through 12. The K-8 campus is where our testing center is located, the Transforming Life Center. It's close to the airport, and then our high school is in the area where it's close to the former Academy of the Pacific. Our teachers and staff are pretty much trained in working with the specific population. I'd say the small, student to teacher ratio really helps with the teachers in being able to understand the students' strengths and weaknesses. They really know the student's personality. It's kind of hard to miss it, right? If you think about how, the small classes really enable the teachers to spend time one-on-one with them, to actually be able to chat with them, to understand them, to acknowledge their what they need help with. And so I think that really sets us apart with that low student to teacher ratio, and the customized, individualized attention is really hard to beat.
How a parent or even a child who has dyslexia and has to go through this relearning process, whatever it is that you're sharing with them and ask this, how difficult is it for them to overcome?
I think often in talking to parents and, sharing with them the testing results, let's say their child is indeed diagnosed with dyslexia. Now, what is really the most challenging, often from my anecdotal experience and professional experience, is to help the parent understand that just because the child is diagnosed with this learning difference does not mean that they cannot learn. Right. So there is the learning difference, and which is why we highlight the divergence, the difference, and we're not calling it something such as, a severe impairment that would prohibit the child from being able to learn. That's just not the case. They learn differently, which is why it's all the more important for the parent to understand that I do have a child who is neurodivergent. So now what are some specific tailored approaches can I use in helping the child narrow the gap while still boosting that confidence in learning? Right. So I think the myth goes that, oh, if you have dyslexia, it means that you just can't read for life. That is completely not true. There is, it falls on a spectrum. The reading impairment, the reading level and ability also falls on a spectrum. There are kids who can have what we call a milder case of dyslexia. Maybe we're looking at something that is, fluency. The child is able to read accurately, but the child is just going to have to take more time in being able to kind of decipher and decode the words. And then there are children who may be struggling with more of that difference and difficulty, where they're going to need a different set of interventions. So I would say the first and the most important thing, what I would often love for parents to understand, is to acknowledge that, yes, your child's brain structural formation is a little different. It looks a little different. The wiring is a little different in the brain, but it does not mean that it's setting them up for failure. And in fact, there are plenty of examples in the community or in our society that highlights a lot of celebrities and people who are very successful in being able to achieve what they want despite having this condition.
For someone who is like hesitant and thinking, okay, I don't want to take this step, what would you say to encourage them?
As with any condition, right, the sooner you quote unquote catch it, the sooner you're able to identify it, the better odds there will be, right? There is a critical learning period for children. And the sooner the parent is able and willing to get them help and support, the better the odds will be in the child's ability to kind of build other compensatory strategies to receive the intervention, to get the accommodation and support that they need, and resources to build them up. And so I think the idea is to understand that there is a need to clarify what really the child might be struggling with, to understand their strengths and weaknesses rather than shying away from the problem, especially parents being the true experts of their own children. They would be the first ones to really know, and they can tell that, hey, something isn't quite smelling right. Let me talk to the teacher. And if the teacher, corroborates, then we'd say, okay, I think there's a chance that we should really look at, or at least to explain why the child might be struggling. And sometimes it doesn't have to be dyslexia. There are many cases that come through that end up not being a dyslexia case. There are other contributing factors that we're able to pinpoint, and then that's going to help, the child really thrive in ways that maybe parents were not privy to prior to the evaluation.
So there's an event coming up at ASIS, the Free STEM Roundtable hosted by the robotics team Waffles. Tell us about that event.
The spots are really filling up quickly. There's still some room left for any high school students who are interested in attending this free STEM roundtable that's hosted by the ASIDS robotics team. So our team name is Team Waffles. And then the Armed Forces Communications and Electronics Association. So we team up on October 18th from 5 to 7 o'clock at Damon Hall at ASIDS High School. So you can RSVP, going to our social media, visiting our website, asids-school.org, where the students will have the opportunity to explore their interests and potential in science, technology, engineering, math subjects, STEM subjects, pretty much. And it highlights really how many gifted students, including those with dyslexia, are passionate about STEM and what they can really do more with this area of their interest.